Hi there, it's Melissa Cady, the Challenge Doctor. I'm finally back from Australia, and I just wanted to share a few thoughts. I'm sure if you're human, you've had some thoughts that maybe sabotage maybe your behavior or perhaps the direction you're going. I'm sure if you've had anyone that's maybe negated or said, why are you even thinking about doing something like that, whether it's at your job or maybe just trying to do something for yourself that's different, and they somehow make you feel small about it or that you can't do that. It's very easy for us to many times just not do it. And unfortunately, that doesn't get us any further in life. And you can look at many other examples, and in the sense of even changing your lifestyle behavior and going to the gym, and how your words in your mind, not just the words that come from other people, but the words that you use in your head are going to dictate your behavior. So no matter what you do, you have these emotions, you get these thoughts, and they lead to a certain behavior, which many times becomes a habit. And that habit persists for sometimes years, decades, or whole lives. And you talk to some people and they look back on their lives and they think, well, why didn't I do that? Well, there's plenty of times where we have to really believe in ourselves and also change the words that we're using. And that applies just as easily to dealing with pain. And many times people will see pain as a bad thing, which is understandable. If you put your hand on a hot stove, it's telling you don't touch that, and you think, I should not do that. Well, in reality, there's these opportunities where you have pain and you realize that it's not just a situation you have to get away from. So a lot of people try to go to the gym, or they never get there because there is a certain level of pain involved. And that is a kind of pain or a challenge that people do have to overcome. But the thoughts that we use in our head that interpret that situation or that environment as not being enjoyable or painful will keep them from doing that. And so I've had a couple conversations recently with some close people in my life, and there are times where you realize who you are and what is going to allow you to be more successful. And if the words you're using, it creates an environment that's not helpful or enjoyable, then sometimes you have to surround yourself by people that are very positive or trying to accomplish the same thing. And so if you find a way to use positive words that it feels like it would be enjoyable to spend time with this particular friend or in this particular environment or this setting, then you can be a lot more successful. And so those thoughts will be a lot more positive, and then you can create these behaviors that will actually get to the results that you want, and you won't have the sabotaging situation. So that's just an example. And even in relationships, sometimes we're told negative words about things, but to jump back into pain, it's not just fearing pain of a workout or pain itself, but there's sometimes things that happen in this medical field that many of us on the inside are really trying to change. And it's a situation of looking at images and how powerful it is in your mind. So the words that you use when you interpret an image, even if it's not relevant to your pain, can determine the behavior you have, which means many times people avoid moving. And that avoidance of movement can lead to problems in functioning later, and this can be a snowball effect. And it's really hard to prove to people to try to unravel all of those changes in behaviors that just made their pain worse. So an MRI many times, and I've talked about it many times before, many times it can be very helpful and powerful for certain situations. For the average person in most back pain, it's not very helpful. In fact, it creates this fear, and people think that they're going to hurt themselves when in fact our backs are incredibly powerful and strong. And there's a lot of understanding and education of pain that myself and a lot of people are trying to do. But I just wanted to remind you that the words you use and how you're interpreting situations is going to determine those behaviors, whether it's avoidance of pain or avoidance of activity or avoiding the things that you love to do, or potentially some projects or things in life you want to do. So I really encourage you to evaluate your thoughts and realize that you are way more powerful than you think. And as I put in my hashtag, don't be a doom and human, that's called catastrophizing. If you've never heard of it, it means that we interpret negatively things that are going on, which can incapacitate us or keep us from doing the things we love. So keep enjoying life. And of course, I want less pain for you all, but it's how you interpret it. And again, I'm Melissa Cady, the Challenge Doctor. And remember to challenge your health before your health challenges you. And remember about the words you use in your head. I'll talk to you next time. Bye-bye.